Beginning with this year's elections, voting gets a whole lot easier.
Your mailbox is your ballot box.
Your ballot packet comes to you in the mail.
But only if you're a registered voter. If you need to register or update your address, do it today at elections.hawaii.gov.
Look for your free Hawaii elections guide in the newspaper or at these locations statewide.
The deadline to register for the general election is October 5th, so don't delay.
Hawaii votes by mail.
Well, good morning, Hawaii. It is Monday, September 28th. I'm Ryan Kalesuji, joined by Yunji Denise. This is Spotlight Hawaii, a conversation that is being brought to you by the Office of Election, who, with that video there, you saw the deadline is October 5th. For those of you who have not yet registered in the general election, encourage you to head over to the Office of Election website to do just that and make sure you register and vote and find more information to vote by mail with the general election coming up. And today, Yunji, we have another special guest to talk a little more about the state's response to COVID-19.
That's right. We're going to be joined by Lieutenant Governor Josh Green. He is always a very popular guest on this program, always gets lots of questions and comments. We see them already flooding in. Please put your questions for the Lieutenant Governor in the comments section right now. We want to welcome him in. Of course, the Lieutenant Governor has recovered from COVID-19, which is fantastic news. Let's start with the basics. How are you feeling?
Thank you. Great to see you both. I feel great. I feel fine. I had pretty severe symptoms for 48 hours back a ways. Now the fatigue you see is just regular work fatigue in my eyes. I've been feeling asymptomatic now for like 10 days or something. I actually got released a week ago Saturday. That was the 10-day period that the CDC recommends, but I stayed in for an extra week to be with my family who were isolating because they had been close contact with me. But I really feel blessed that I had a pretty mild run through COVID.
Okay, and I want to ask you to adjust your screen a little bit so that it's not cutting your head off, because we want to make sure, perfect. Okay, let's dive in. Well, before we do that, I know that you mentioned that you were in quarantine with your family. Everybody wants to know how your son Sam, whose bedroom you took over for that quarantine period, how he's doing, how your daughter's doing, how your wife is doing. We know that they actually did not test positive for COVID, and that is fantastic news.
They're doing great. So first of all, Jamie and Maya and Sam are doing fabulously. They are not sick in any way. They tested negative, and Sam gave up his bedroom very graciously to me, mostly so that I would stay away from those guys. His bedroom happened to be the one at the end of the hallway. We have a medium size, like an 1,100 square foot, 3-bedroom apartment. And so I was able to have a bathroom and a room, which you need to have. We were super cautious. We did not mess around at all. They did not let me leave the little corridor, and nor did I want to. And it was one of those funny things. They like strolled up a little food tray, a pink food tray, which was Maya's old princess food tray, 3 times a day, and gave me food. And we FaceTimed within our apartment just so we could see one another because we missed each other. But everyone did well. Maya went back to school today. She's at Iolani. Sam is doing school from home. He's at Voyager Charter School. Jamie is still playing it very safe because, we're cautious as people. We don't want to take any risk. Though now we're totally clear, and I've started resuming some speaking engagements, mostly from Zoom and whatnot. But I'll tell you that the experience of isolation is of consequence. That is a very serious situation for people. It's something that we have to not forget. The worst thing, of course, is if, God forbid, you're very sick. As one of my staffers is, that one of the 2 security details that you guys know tested positive. One of them did great, had almost no symptoms whatsoever, sailed right through. The other guy got very sick and is experiencing his recovery in the hospital. So you just don't know. You just don't know how it's going to play out. We got pretty lucky. I'm fairly young. I'm 50. My wife is Jamie's 42, and so she's even healthier and didn't have any problem at all. But they avoided me in the right way. And then even after I was cleared, we made sure that I had a mask on at all times because you just can't be too safe. So all these things are lessons learned, and I hope that people will take that to heart. Like, anybody can catch it, including your lieutenant governor. And I was in a car with one of my staff. We all had masks on, but we were in a car together for over an hour, and that's what ended up resulting in us spreading COVID.
We want to bring in some questions from the audience, and one of them specifically asking about someone who is actually dealing with COVID-19. Reese asking, my whole family has COVID-19. How do you know when it is time to go to the hospital? What would be a red flag? Your oxygen saturation? Please let me know. What would you recommend as someone who has gone through this, and also as a doctor? When should someone seek that extra medical support if they need it?
When your oxygen saturation is 94% or less, or if you're having any subjective trouble breathing. Either one of those things, go straight to the hospital. Also, if fevers are really high and you're really just plain feeling bad, sometimes that is a sign that you have a very high viral load and you need to get care. So those are the three things. I hope that individual, I hope Reese, first of all, I'll pray for you, and we hope that you do well. I assume you will. But yes, have a pulse oximeter at home. And if anyone's 94% or lower, go to the hospital. The way oxygen saturation works is 97 to 100 is normal. The lowest I got was 95, it turns out. I was usually around 97. Reese, check. If you go 94, 93, 92, go into the hospital and get care, because people often don't feel very symptomatic in the low 90s, which is one of the strange things about COVID. And then if you fall into the 80s, it's like going off a cliff. All of a sudden, your oxygen saturation is not able to take care of all of your important organs, your heart and your brain. You will be at risk of being confused. All these things are really a problem. So that's why we focus on that number.
Okay, let's shift gears here. Sean has a question that I know a lot of people have. Sean Mahoney asking at 10:34, what's the status of inter-island travel from Oahu to the other islands? Will Hawaii residents be able to travel within the state by the time residents of other states can travel here? Of course, we are looking at the October 15th date for opening trans-Pacific travel with a test. We want to get into that, but let's talk neighbor island to start.
Well, thank you for that question, Sean. That would be my recommendation. In fact, it is my recommendation that we no longer need the inter-island travel restrictions, that we don't need the 14-day quarantine as of October 15th. The Department of Health was able to catch up on an incredible amount of work these last 30 days and has certified that we now have only 1,835 active cases left. Almost all of those are on Oahu. Those individuals are still at home in isolation. So we have very little risk as a state. And I think that the mayors are all weighing whether or not they would also like to ask for a pre-test for travel so that people didn't have to quarantine inter-island. They'll make that recommendation in the next couple of days, I'm told. But come October 15th, I'd like us to streamline things if possible so that we have one consideration as far as travel goes, and that's getting a pre-travel test that's negative within 72 hours of people's travel to Hawaii. And we'll unpack that whole thing. We will see the numbers continue to roll in. We had 90 cases today, 90, which is good. Like I said, 1,835 active cases, and we have 150 people in the hospital, which is less than 50% at our peak. We were at 318 a month ago. So things have gone quite well, knock wood. People have done a great job with their social distancing and mask wearing. And I think that let's not make it too confusing when we have travel resume. But that is a lot to say, and the mayors have to make that judgment call.
Regarding the October 15th reopening and this testing period, what is the process in which people have to get this clearance test? We do have a question from Jody, who said that she actually called one of the locations. She said she called CVS, Rite Aid, Walgreens, and they said that they do not offer testing without symptoms. What advice would you give to if these problems arise? So for those people who are looking to take this test, when do those services and those partnerships that have been established begin operating, and can people expect to be able to get those tests that they need in order to get into the state?
Yes, and I thank you for that question, Jody. So I'll be hosting a pretty full and vibrant press conference, it looks like, on the 1st. So 15 days out, to give some details. I'm going to give them here now, too, what we have up to date. A lot of people are having that experience because it's still 2.5 weeks out. Come about the 10th or so, all of those systems will go live. Because remember, a person will have to get their pre-test within 72 hours of their departure for Hawaii, their last leg of their departure for Hawaii. So let me just roll this so everyone understands it. And then soon CVS and Walgreens and all of our partners will start putting it up on their websites. They don't want to do it too early because, number one, they want to make sure they trust what Hawaii Us is planning. And it takes some resources for them to do it, but we are in contract with them and we're ready to go. So here's the deal. Within 72 hours of travel, a person will get a nucleic acid amplification test, a NAT test from a certified CLIA lab. That's the regular test that you get. Okay, that is a PCR test. Within 72 hours of your departure, you'll get your result from your testing partner, whether it'll be an email or they'll print out a test result and it'll say you're negative. You'll be able to travel. You'll upload it into your Safe Travels. I want to call it an app. It's a website. It's a digital form. And then carry your form with you. And then you'll come here. We will check it and you will go and have your vacation. Or, of course, our returning residents will do the same. They'll get a test and then they will not have to quarantine either. So within 72 hours, you'll get this nucleic acid amplification test, and that's it. Here are the partners that will be available to us. CVS, Walgreens, Kaiser, Hawaiian Airlines, United Airlines, another wildcard airline I'm not going to mention today until they make their mention. Also, some other partners. We will have Quest Labs, which is the biggest testing entity in the country. That's going to be another option for us where I believe we will have them in all of their outreach will go to Walmarts where people will be able to go and get a swab. So there'll be a lot to update people on this Thursday, but I want to reassure people that it will not be that difficult, we hope, to get a test. We'll also offer some mail-ins, but that was contentious. The mail-in testing will have to be observed testing. You'd be very specific about that. The governor felt strongly that we want to make sure the tests are observed. And so there are going to be some partners that do observed mail-in testing with telehealth. Like you'll do a Zoom little meeting while you do the swab, put it in the container and send it off. So I would tend to recommend to people to just go and do it at these places. A lot of the tests are going to just be the anterior nasal swab, not the nasopharyngeal swab. Most of them, like for instance, the Abbott ID Now test is a rapid test. You'll get your result within 13 minutes, get it right there, and then you're all settled and done. Then come and have your trip to Hawaii. So that is the program. We are also not going to require testing for under age 5. Under age 5, so 43210 will not need a test. They will be able to just simply travel with their parents, and so people will not have to pay for that test. The reason for that, before people ask, that age group is connected at the hip to their parents. And so if a parent is negative, then we know the child will be negative in all likelihood because they spend so much time together, and vice versa. So by testing the parents, it solves that problem. But kids who are in school could be different. A 15-year-old or a 13-year-old or a 9-year-old like mine, they could have caught it. And so we are requiring the test. It might not be quite as easy as we would like for those individuals to get tests for kids. We're working on that, and we're working on our partners bringing down their ages. It looks like one of them will get down to age 7 at least. It's going to be a challenge, and it's not going to be totally perfect, but it will decrease the risk. We will be only the second state in the country, joining Alaska, to have a pre-travel test to make sure we're safer than most.
Okay, Terrence has a question. He says, how would the state handle tourists or returning residents if they did not get their test? Ryan, that's at 1043.
Straight into quarantine, 14 days. That's it. So they can leave sooner than 14 days, but they will be in mandatory quarantine. They will be checked on over and over and over again. And if they break or violate their quarantine, if they haven't had a test, they will be subject to a $5,000 fine or up to a year in jail. We are still discussing the possibility of having designated quarantine hotels or destinations exclusively for those individuals that are crazy enough to not get a test. I don't know why you wouldn't get a test. You got to be out of your mind to not get a test and come here and be in 14-day quarantine. As a guy who just was in 14-day quarantine in my boy's room, don't do it to yourselves because it is terrible. But some people may do that, and we'll be checking on them. We will also be informing the hotels of their guests if they have individuals that have not adhered to the pre-test. So we'll be sharing that information openly. so that the hotels also know which of their clients are, in that limbo, basically, or in a 14-day quarantine position.
Can you get the test? Let's say you haven't taken it and then you get to Hawaii. Can you get a test once you get here, and will that waive the quarantine, or do you have to get it before you board?
You have to get it before you board. That may change over time, but when we first come out of the gate, the program is going to rely on a pre-testing program. The reason for that is we right now have a limited number of tests, 4,000 tests per day at the most here in Hawaii. And even that's hard for us to process at the moment. If we were to allow people to get their test when they got here, we felt all along that tons of people would skip out on the test and wait until they arrived. First of all, they're taking a risk, because if they test positive, they're going to be stuck here and they're going to be in a hotel quarantine, which is not a good situation. Eventually, as we ramp up our testing, we've done a request for proposal and approved it to get up to 13,000 tests a day. And we're hearing that the federal government's going to be putting out a lot of extra tests coming soon. It's a different kind of test. We can talk about that. Eventually, we will get to a place probably where we will have, at least for returning residents, some kind of program where a couple days after returning, we can get a test for a person. I think it's going to be most relevant for people that go for really little short trips and then come back, where you really can't find enough time to get a test and clear yourself. I'll be working on that in the coming days, but for now, very long answer to a short question, you have to get your pre-test beforehand. Important. Let's say you get your test 2 days before you fly, 48 hours, and your test result is not in your hands, it's not back yet. If someone comes here, we'll let them into the state, but they will be in home isolation or hotel quarantine until they get their negative test result. As soon as they upload that test result into their Safe Travels profile, they'll be cleared. So that could happen. That's why the very best approach for people would be to go to one of the places where they do the rapid test, get your result right there on the spot, know that you're negative, and then come have an awesome vacation.
And if that test, though, is positive, so let's say that they did wait and they were here, they get the test results back, it's positive. I'm assuming that they then would have to wait here in the state of Hawaii for that 14-day period and not be allowed to take that flight back home, because will airlines allow them to, in turn, get back on the plane to head home once their vacation was sort of ended?
Those people are totally screwed, because what's going to happen is they're going to be here. They're going to have to stay here for 14 days. They can't get back on an airplane because it's unsafe to travel. They will have to pay for a 14-day vacation, and it will be in isolation. And to add insult to injury, if they were traveling with their loved ones and they tested positive and the others tested negative, you know what they are. They're now considered all close contacts of a positive individual in the state of Hawaii, like my family was. And that will be 14 days of isolation with that person. So the entire group that traveled together, who are close contacts, who live together presumably, will have to isolate. Therefore, the only smart thing to do is to get your test beforehand and get your result beforehand, unless you really want to roll the dice. Now, very few people are going to test positive. This is one of the interesting myths and confusions that some people have had, okay? A lot of people are saying, well, wait, we want a second test. Look, I'm all for extra security, but let's break it down a little bit for people. Right now, out there in the world, maybe 1 out of every 200 or 300 people are positive. The asymptomatic, they feel great, no problem, okay? 1 out of 200 or 1 out of 300 people. That was the number that we found when other states were doing some broad testing. We had the test within 3 days of their travel. So we will catch a ton of any cases that were asymptomatic people. Not every one of them, but a lot of them. We will bring that number that's already low down even way lower, probably to under 1 in 1,000 people. Now, let's say 7,000 people travel every day. Okay, maybe 7 individuals will come as asymptomatic carriers of COVID. Not particularly infectious, but it's not nothing, okay? 7 people, very small number a day. We've been dealing with an average of 102 per day for the last 10 days, and before that it was up to 250 a day, right? We can absolutely handle that. If we were to add a second test, which would be great if we just had perfect unlimited testing, we would be testing to decrease that number from about 7 a day, maybe down to 2 or 3. Now, we could do that, but testing 7,000 people a day at $120 a pop would cost us like $800,000 a day, plus the testing, plus isolating people to save ourselves 3 or 4 cases. So we have to ask ourselves, what's the best approach? And the best approach is to do good contact tracing, good testing when people are symptomatic, and be ready in case anyone gets sick. That's how we're approaching it. If hotels want to add extra tests or the counties, that's great. Never will I shy away from extra safety, but we still have to use our resources wisely. And we want to use our 4,000 tests for people who are sick, for people who actually need to be contact traced, like when there was an outbreak in Kalihi, when there was an outbreak in Waianae, in Kona. That's the better approach to COVID. Good contact tracing, good testing when you need it, and wearing a mask all the time, and we'll be able to function very nicely.
Okay, King of Mills at 1045 says, any international testing partners? We know a large part of our travel population, our tourist population, and a big economic driver are the international visitors. What's the plan for those folks?
That's a great question. I'm so glad that was asked. So the plan is to have the same standard, nucleic acid amplification test. Now, in this case, it won't be at a CLIA certified lab because that's a United States designation. So what we've done is we've reached out to Japan, Korea, Canada, which are 3 of our largest partners, and any other country that has this consideration, they will be able to have the same standard. So if they get a nucleic acid amplification test, which is the same test that they've got there as we've got here, if they use that test with their national lab standard, they will be able to travel in. We're going to ask them to translate it into English so that our guys at the airport can review the test, but it's not that difficult to see NEG, which is negative test result, okay? And we are working with those countries. It should not be a problem. The governor is very optimistic that at the very least, Japan, who is a hugely vibrant partner of ours, will be super organized. As you know, the Japanese culture is very diligent about these kind of things. They were ahead of the curve with mask wearing. They have also been ahead of the curve with testing. So we will have that same standard. And we're going to put all of this stuff up on our website. One of the purposes of having on the 1st this large press conference is so we can have a clear visual of what you got to do, which I've been describing, and the frequently asked questions, of which that is one of them. And it's going to all be at hawaiicovid19.com. hawaiicovid19.com. We're going to spray this information out across the whole planet, okay? So I hope a lot of people will see your show and see the press conference and see a follow-up, which I'll also likely have on the 8th of October, maybe even at the airport, so we can walk through how it's going to go. But it's really not going to be that complicated. It's the right test, nucleic acid amplification test. By the way, that is not an antigen or an antibody test. This is the standard. That test within 72 hours of your trip, and heck, come here for a month of vacation. That would be great.
You know, we're also hearing a lot of the developments of the saliva testing. You know, OceanNet is one of those partners who are working hard to get that online and get going. Should that sort of get approved and begin moving through in that process, obviously testing would become a lot more, it would become easier and more readily available. What sort of significant impact would something like that have on the current system and how things would evolve?
It would be a game changer. I wrote that into our rules, so we will be accepting saliva tests. Again, as long as they meet our initial criteria, which is the testing category, which is these nucleic acid amplification tests. I did do some reading this weekend. One of the benefits of being stuck in my boy's room with COVID was I got to do a lot of reading. And in the American journals, we've been seeing that these saliva tests are very reliable. We will be using them. When the ultimate test comes in from OceanNet, once they've gotten their emergency use authorization, we have high hopes we'll be able to really use that. A lot of them are going to be less expensive, we will see. Right now, these tests are not cheap. That's one of the challenges. I think that one of the airlines, the lowest price I've seen is $90 for a test. The highest price I've seen is one of the airlines is going to have it at the airport, no questions asked, but $250 a test, you know, right on the spot at the airport. So that's a pretty big range. The average price looks like about $120 to $130. But to your point, Brian, when we get to those tests, especially once the antigen tests are approved and they're easy enough to do, and especially with the saliva, we believe that price point is going to be closer to $20 to $50. And then ultimately, when Mr. Sullivan's test or that category gets approved, those can be really cheap, like $5. But they haven't all been approved yet, and we are trying to stay with a very strong standard so that we don't get false negatives or false positives. We want good results, because imagine how unfair it would be to someone if they got a false positive test. They would be stuck for 2 weeks here in Hawaii and unable to enjoy their vacation. So we want to use the gold standard, and right now that gold standard is the NAT test.
You know, I see a lot of business owners from gyms and other bars, different restaurants writing in, asking your view of the mayor's 4-tiered system and the restrictions that are put upon some of these businesses. What are your thoughts on the system that he's put in place? And do you think that it's too restrictive? Do you think it's just right? Would love to hear what you think about it.
Well, I think that it's a little bit too restrictive. I think that we should have been in tier 2. It didn't make any sense to me that we came off of the hardest period and we were still in tier 1, because then there's nowhere else to go. I really don't know what that means exactly if all hell breaks loose and we got to get more restrictive. So there's that. Secondly, I am appreciative of the mayor and his position on outdoor exercise and activities. I still would personally ask people to stay as well as they can to their own household. You have already infected your household if they're going to be infected. Making out at home, hugging, kissing, eating together, that's how you spread it, right? You're in close. The households are already contained, so that should be our social groups, going to the parks and the beaches if possible. That's also why they had the standard for restaurants. Why do they have a slightly stronger standard for restaurants? Because they're indoors, and indoors is a lot riskier. I think that the rules are a little bit too harsh on some businesses, and I think that and I'm not saying they're not doing this. I think that they would be honor bound at the city and county to use their CARES money, that they have, some of it, to make sure they're always subsidizing anyone who they force to be closed. Cover their overhead, cover their rent or lease, because as I see it, some of the establishments like gyms or even some bars who went through a lot of extra protocols to be safe, not all bars were good, some were bad, but many of them were good. If you're going to shut them down for a very long period of time, you better pay their overhead. That's the only fair thing. Overall, we had to bring the numbers down in order to be able to open up to travel. People ask, why do we open to travel at all? Well, a lot of people are suffering very terribly. Over 150,000 people without jobs. And that has to end. We have to get people back to work. We just have to do it safely with a low rate of COVID. I do appreciate greatly the city and county and the state's mask mandates. I think they should even be stronger, but they're good. So it's a mixed bag. I think that what you're going to see is some adjustments. I think that if you're outdoors, you're pretty low risk. But please, if you're outdoors with people that are not from your household, no matter what you do, wear a mask. I don't even care if you're at the beach. Frankly, anything short of being in the water, you should have a mask on if you're with people that are not from your household, because you will spread it. You spend 2 hours laying next to a buddy or a girlfriend at the beach, you just adopted all of their close contacts into your risk. And you don't want to do that, because it's kind of easy to catch COVID. I hate to say it. And one of my 51-year-old friends died, which was terrible. And he was healthy. He was a marathon runner. One of my team members who's 60 is in the hospital with serious disease, serious COVID-related disease. And he had nothing wrong with him except for being a sassy guy, okay? So he is really going through it, and we pray for him because he caught it, he was unlucky. So it's really out there, and we have to keep COVID very low if we want schools to open comfortably and our economy to be restored before I'm able to get the vaccination program up and going. We will do that, though. I'm on that with our HIEMA team. We will get people a vaccination if they want it, totally optional, but we will get that vaccination to Hawaii's residents as soon as we can so that we don't have to deal with quite so much of these restrictions.
You know, our time here, unfortunately, is wrapping up here, but I do want to give you an opportunity to sort of just a final message and also just kind of your thoughts as we move forward. Obviously, we are now in this sort of tiered system now that has been reopened going into about a week now, and your thoughts about just moving forward and the numbers that you anticipate seeing with sort of people getting back to business as usual, and any other final comments that you may have.
Sure. I really appreciate everyone's hard work. I appreciate to no end people's sacrifice. It's incredible, and their well wishes to me personally when I had COVID. So thank you guys for that. COVID can be caught by anybody, by your lieutenant governor, by your nurse, by your buddy, by your child, anybody. If you're in close contact with somebody for more than 15 minutes and they have asymptomatic COVID, you're going to catch it. So please always wear a mask. That's how we knock this down. Our contact tracing team is doing much better. Our testing is much more vibrant. So we now have a lot of the public health apparatus in place to keep ourselves safe. That's why we're able to now open up our travel and our economy. There are some outstanding questions. I appreciate that. People ask them about inter-island travel, about international travel. Those final decisions will get made in the next couple of days, but I will have the Trans-Pacific travel program up and ready for October 15th because people need to survive. And we will test and test and test to make sure the virus is suppressed. But please, everyone, be confident. Things are better. They're much better than they were a month ago. We're a lot safer, but let's keep it that way. So you've done a great job so far. Another couple weeks, we'll begin to hear about the vaccines, and then I think we'll see the light at the end of the tunnel.
Okay, thank you so much. Always so informative. Thank you so much, Lieutenant Governor Josh Green, for joining us this morning.
Thank you.
Oh, well.
Okay, well, that was really interesting because, Ryan, we really got a lot more detail on what the Trans-Pacific travel program is going to look like and some lines in the sand, if you will, when it comes to when you get that test. There had been thought that you could maybe get it once you get here. That's obviously sort of off the table. You don't want to do that to yourself. You will be put into a mandatory 14-day quarantine, and then you risk, being stuck here for a long period of time. So if you can have access, and he did name a bunch of partners that it sounds like will be offering the test, then it should be possible to have access to that testing within 72 hours of your departure.
And it also sounds like there will be other airlines. Of course, we know that United and Hawaiian Airlines offering that service. The Lieutenant Governor also saying that there are other airlines out there that will be making those announcements as well. There are some questions from those who have already tried to look into these testings that have been set up by CVS and Walgreens in these partnerships that the state has set up. And he's saying, of course, that they are still working on some of those agreements, and that has not been really announced or pushed out by those partners that they have set up yet. So he's saying, wait until maybe more as we head towards that October 15th deadline, so for more information to come out there. But right now, they will not necessarily be releasing that. The Lieutenant Governor saying, though, that there will be a press conference maybe as soon as later this week or potentially next week to discuss more about sort of the protocol that which they will follow for this opening of Hawaii on October 15th.
Yeah, and one big headline that came out in our discussion, one big difference, because we did have the governor on last week, Monday, is the age range for when kids can actually get their testing basically affiliated with their parents. He's saying for kids under 5, because they tend to have such close contact with their parents, they will not be required to take a test, but anyone over the age of 5 will be required to get that testing. And there still is a lot of gray area when it comes to who is actually offering testing to children under 12. Our understanding is that a lot of the partners on the mainland will not offer those tests for minors under the age of 12. So family travel could be pretty tricky, but for people with very young children, their results will basically count for their children.
And of course, we saw a lot of questions about the lifting of the inter-island 14-day mandatory quarantine. The Lieutenant Governor saying an announcement is expected within the next few days about this, that they are continuing to work out some of the details in discussions with the other mayors. We also heard that statement when we interviewed DBID Director Mike McCartney last week, saying that that was also an active topic that they are looking to make an announcement of over the next few days. So we can anticipate something like that happening later this week, as well as I know that there are many who are looking forward to getting back to traveling between the islands again without having to go through that quarantine period. So we'll continue to keep you posted. Again, this is a situation that it seems like every day, every hour, new information continues to come out, and glad to get an update today from the Lieutenant Governor.
Yeah, and we're going to be shifting our focus on Wednesday. We're going to be talking to two complex area superintendents, one from Hawaii Island and the other from here on Oahu, to tell us what school has been like and what they're anticipating as they soon head to fall break, and what it's going to look like after that. We'll be talking to one from the Ka'ukea'au district, and then the other one from the Lelehua, Mililani, and Waialua complex. So that'll be interesting because we're really going to hear what it's like on the ground. The Department of Education has offered up these two guests to us so we can get into the nitty-gritty of school. Friday, Ryan, we're going to be talking to some small business owners.
That's right. We talked about it briefly with Lieutenant Governor, but one of the industries that is certainly hurting in this new tiered approach are that of gyms and those who have these sort of establishments for workouts. Of course, we know that they are currently not allowed under this tier 1. And really, it's going to be a while before they can actually get back up to the levels that they were at prior to this latest shutdown. So we're going to be talking to some gym owners and those in the fitness community about how they have been impacted by this and what sort of things that they are doing to sort of help to maybe get those rulings changed, and their discussions with those in the city and county of Honolulu to see if there was any way in which they can be deemed and have sort of those restrictions lifted. We'll get a better insight from them and what they're experiencing. Again, that's happening on Friday.
So until Wednesday, we wish you a fond aloha. Make sure you do register to vote. We want to thank our sponsor, the Office of Elections, for helping us bring you this conversation every Monday, Wednesday, and Friday at 10:30. As the governor, or Lieutenant Governor rather, did say, do wear a mask. He even encourages folks to wear a mask on the beach. If you're not in the water, wear it as much as you can all the time, whenever possible. And he was saying that, even after he tested negative for a while, he was wearing one in his own home just to keep everyone safe. So these restrictions are very important. They're difficult for a lot of us, but they are necessary at this time.
That's why, again, we want to thank you for tuning in, and we'll see you right back here on Wednesday. Aloha.